In 1811, the English novelist Fanny Burney lay awake while a surgeon prepared to remove a tumor from her chest. There was no anesthetic, nothing to dull it at all. She stayed fully conscious through the entire operation, felt every single stroke of the blade, and later wrote it down in a letter that survives to this day and is almost unbearable to read. For nearly the whole history of surgery, this was simply how it worked. You were held down, wide awake, while someone cut into you as fast as humanly possible. So how did anyone survive it? The answer involves a surgeon so fast he could take a leg off in under 30 seconds, and the grim reason that speed was the only mercy on offer. It involves drugs that might put you gently to sleep or might quietly kill you, with no reliable way to tell in advance, and it involves a Stone Age skull with a hole cut clean through it, and the genuinely astonishing proof that the person lived for years afterward. Let's start with the single most important tool any surgeon had, because it wasn't a drug, it was speed. The defining fact of old surgery was that the patient was awake, and every second they stayed awake and in agony brought them closer to death, not from the wound but from the shock of the pain itself. Extreme pain sends the body into collapse, blood pressure crashes, the heart races, and a patient can die on the table before the surgeon even finishes. So the surgeons who survived in the profession were overwhelmingly the fastest ones. Speed wasn't showing off. It was the closest thing to mercy anyone in the room had to offer. The most famous example is a Scottish surgeon named Robert Liston, who became something close to a celebrity for exactly this. Liston could amputate a leg in under 30 seconds, working so fast he'd reportedly clamp the bloody knife between his teeth to free up both hands. Students would pull out their pocket watches the moment he began, timing the surgery like a sporting event. And in a world with no anesthesia, this genuinely mattered more than skill or gentleness. A slow, careful surgeon was in practice a far more dangerous one, because every extra second the patient spent conscious lowered their odds of ever getting off the table alive. But speed alone couldn't make being cut open hurt any less. So for thousands of years, healers reached for anything that might dull the pain. Alcohol was the near-universal choice. Get the patient as drunk as humanly possible, but it's a genuinely terrible anesthetic. To dull real pain, you have to push someone dangerously close to alcohol poisoning, and a heavily drunk patient bleeds more freely, vomits, and can stop breathing. Plants offered something stronger and far more dangerous. Opium, mandrake, henbane, and hemlock can all sedate or numb, and medieval healers even soaked a sponge in a boiled-down mixture of them, dried it, and held it under the patient's nose to breathe in before an operation. On paper, that sounds like anesthesia arriving 1,000 years early. In practice, it was a gamble with the patient's life every single time. These plants carry wildly variable, extremely toxic doses, and nobody had any way to measure a safe one. The exact same recipe from a slightly stronger batch could shift from asleep and numb to dead with almost no warning. Some patients were sedated. Others felt nothing because they had simply been poisoned into a sleep they never woke up from. It's worth being honest here because there's a temptation to imagine these mixtures as a lost secret that basically worked. The evidence doesn't really support that. They were unreliable and often deadly, which is exactly why surgeons still built their entire craft around finishing in under a minute. So if you can't reliably knock the patient out, you're left with the least pleasant tool of all, restraint. Strong assistants held the patient down by force through the whole operation. Leather straps were buckled across the body, and the patient was given something to bite, a folded strap or a wooden rod, both to muffle the screaming and to stop them breaking their own teeth against the pain. All of this shaped not just how surgery was performed, but what surgery could even be. Before anesthesia, it was confined to the outside of the body and to anything that could be finished fast. Amputations, draining abscesses, removing surface tumors, setting broken bones, even cutting stones out of the bladder. What almost nobody could do was slow, careful, deep surgery inside the chest or the abdomen, because no conscious patient could survive being held open that long. The body's interior was, for most of human history, a sealed room that surgery could not enter. which is what makes the story of Samuel Pepys so genuinely remarkable. The famous diarist suffered for years from an enormous bladder stone, and in 1658 he finally had it cut out, fully awake, restrained, with no anesthetic at all. The stone was reportedly about the size of a tennis ball. He survived, which was far from guaranteed, and he was so overwhelmingly grateful to have lived that he kept the stone in a case and held a private celebration on the anniversary of the operation every single year for the rest of his life. But it would be dishonest to tell this as pure triumph, because an enormous number of people did not survive. Some died of the shock during the operation itself. Far more died in the days afterward, not from the surgery but from infection, because this was also before anyone understood germs, before hand washing, before sterilization of any kind. Surgeons operated in blood-caked coats they wore precisely because they were caked in blood, as a badge of experience. So a person could endure a conscious amputation heroically and still die a week later from an infection carried in by the very hands that saved them. People agreed to it anyway because the alternative was usually worse: a limb rotting with gangrene, a stone causing unbearable agony. Surgery was almost never the first resort. It was the last one, chosen by people gambling everything on the only chance left. And here's the part that reaches furthest back of all. One of the oldest surgeries we have evidence for is trepanation, cutting a hole clean through the skull, performed in the Stone Age, with stone tools, long before anyone could possibly have understood the brain. It sounds like the definition of a hopeless procedure. And yet a remarkable number of these ancient skulls show smooth, healed bone around the edges of the hole, bone that could only have grown if the person lived for months or years afterward. Somehow, against every expectation, people were surviving holes cut into their heads tens of thousands of years ago. All of this ended with astonishing speed. In October of 1846, a dentist named William Morton publicly demonstrated inhaled ether, sending a surgical patient into complete unconsciousness while doctors watched in amazement. For the first time in the entire history of the species, a patient could be cut into deeply, carefully, slowly, and feel absolutely nothing. Within a few years, the news had crossed the world, and thousands of years of conscious, screaming surgery ended almost overnight. Fanny Burney, awake for her operation in 1811, had lived on the very last edge of the old world. So the next time you're lying in a waiting room before some minor procedure, mildly annoyed that you're not allowed to eat beforehand, take just a moment to appreciate the strangeness of what's about to happen to you. You'll be guided gently into a painless, dreamless nothing and wake up with the entire ordeal already behind you, remembering none of it at all. For almost everyone who ever lived before you, that was an impossible luxury, and the single most desperately wished-for thing in the whole terrifying experience of being cut open to stay alive.